Join the celebration, y'all. We don't hear enough about the awesome things that are happening in health systems, so we're creating our own way to celebrate the amazing accomplishments the digital, consumer, and innovation teams have been achieving this year. Let's go!
New choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 371. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about Forward Health shutting down. What led to their sudden demise, and what can we learn about the appeal of tech-first subscription-based health? I'll talk about that. Then join our first ever health system celebration series as we recognize the accomplishments of 4 leaders in digital engagement and consumer experience. You'll hear from Northwestern's Callie Arduine Ihde, URMC's Michael Hasselberg, MultiCare's Jeremy Harrison, and Ballad Health's Taylor Hamilton. It's time to dive right in. Are you ready? Let's go.
Flava of the week.
Forward Health has fallen flat. As of November 14th, a notice on their website said that they will be closing their locations, canceling scheduled visits, and shutting down their mobile app effective immediately, though their medical team is available to support their members' care until December 13th. We don't know many details, none really, so there will be plenty of armchair quarterbacking, and I think many of the points will be valid. Some are pointing to the lack of product market fit or an ultimate misalignment between the offering and its target consumers. Others are pointing to the economics, saying primary care is a tough starting point for a subscription model, which I somewhat understand but also still disagree with based on my experience with direct primary care. But of all of the immediate reactions, the most profound that I've read so far comes from Forward's own head of design engineering and manufacturing, Eric Royland. This is what he posted on LinkedIn. He said, "I feel relieved to say I gave this mission and my teammates everything I could give, and I feel wrecked knowing this journey to provide high quality care to billions of people for free is over. I believe we were onto something, and I'd love to see others learn from us. I believe Forward had the right incentives to create a healthcare system that helped people live healthier, happier, and longer lives, unlike the current healthcare system that makes money when people are sick and equity value when total costs increase. It's no fault of an individual. It's a broken system with poor incentives like regulated margins and local negotiations, players that are too entrenched, and politicians who care more about getting reelected than doing what's best for this country. Healthcare is 20% of our GDP, and no politician could compete for reelection if they truly challenged the current healthcare system." He continued, "I believe Forward had the right strategy to increase access to healthcare, shift problem solving from services to products, and provide preventive care to reduce the need for resource-expensive acute care. The second piece is obvious. The first is more nuanced. Services scale linearly, but the shape of the underlying problem healthcare is solving is exponential. Population growth is exponential. So of course the healthcare system is overconstrained and forced to trade off quality, access, and cost on an efficient frontier. This is why the healthcare iron triangle is so often true. We need exponential solutions, not linear solutions. Services scale linearly. Products scale exponentially. We should be valuing product solutions and encouraging automation. Doctors and other providers won't go away. We'll always need a human to solve the complex problems, whether emotional or scientific. But we cannot break the iron triangle of healthcare without productizing healthcare. And before this will happen, we need to change the incentives. Fee-for-service and one-year capitated payments will not encourage the productization we need." Close quote. There's a lot to take in there, isn't it? And I suspect we'll hear a lot more details soon. But let's face it, sometimes it just sucks that healthcare really is this hard. In Forward's case, I suspect there has to be quite a story behind how they're shutting their doors just a year after another $100 million round. But whatever the confluence of factors that led to their demise, these monumental defeats really do start to add up, to the point where we start to wonder where innovation can succeed. So, let's take a moment of silence in the immediate aftermath of another bold vision falling flat. Then, more importantly, let's pick ourselves up, learn what we can about what consumers really want for their health, and keep moving forward. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
The flow.
All right, everyone, get ready for something a little different. This is our first time doing this health system celebration series, and I'm very excited for it. Can't wait to welcome our first guest, Callie. She's here from Northwestern. Callie, welcome to the Healthcare Wrap.
Thanks. Happy to be here.
Why don't you tell our listeners a little bit about yourself, who you are, and what you do?
Certainly. So my name's Callie Ihde. I've been in the healthcare industry for almost 20 years now. Always technology adjacent. So started my healthcare career working at Epic in implementation. So 6 years of experience traveling across the country, working with different health systems and really understanding the impact that digital tools can have on our organizations. Some positive, some not so. And it really made me passionate about the space. And then after that, I came to Northwestern Medicine. I've been here for 11 years, always working kind of adoption of technology, integrating it into the work that our clinicians do every day, into the meaningful impact we have on our patients, week over week. Working kind of in the Epic space still a little bit, but then coming out of COVID really stepped into the innovation space. So helping the organization look at all the new and emerging technologies, whether that's from a startup company, a big tech vendor is kind of well established in this space. We're really looking to partner with those folks to bring those new technologies to our health system, to our patients, to our communities, to really get out there and tackle the challenges that we're all facing.
I love it. The innovation side of healthcare is always near and dear to my heart. So I'm looking forward to this. And let me set up this series a little bit more because, again, this is new for our listeners. But what led to this and how it came about is I've realized recently when I see on LinkedIn some really cool celebrations and acknowledgments and milestones being posted about from health system leaders, I realize that we still don't hear enough about these awesome things that are happening in health systems. So we wanted to create our own way to celebrate those accomplishments, especially on this digital innovation and consumer-facing side of healthcare. So I wanted to start with this type of series and just kind of see where it goes. But I think there are some areas in particular that are definitely making progress in the industry. And those are things like consumer experience and engagement, patient acquisition, to helping us understand, like, how do we get people who are looking for care? How do we get them to the right facilities, the right providers? How do we actually get them the care and connect them with in the ways that we need? And then what tools are we using? Of course, how can we have a series with anything digital without talking AI possibly, somewhere in the mix? Like that, we're all still learning there together. So I think somewhere in those areas are where we'd love to just celebrate what's happening in healthcare. So with that, I will turn it over to you. I would just love to hear, what do you want to celebrate? What do you and your team see that has been worth acknowledging in 2024?
Yeah, and I want to start by thanking you for this opportunity. We say at Northwestern Medicine, our Midwest modesty gets in our way quite a bit, and so we do a lot of really great things. We are helping our patients. We are providing care to our communities day in and day out, and we don't always step back and say, hey, how can we let others know what we're doing and how do we get the word out there accordingly, especially when it comes to some of the digital transformation and innovative work that we've done. And so I'm excited to share, our big effort over the last year has been partnering with our Office of Wellness to really tackle some of the challenges our clinicians, particularly physicians, are facing in terms of administrative burden. And so ambient documentation is not a new kind of, suddenly emerging technology. It's been around for a few years, but with generative AI and the ability to add large language models into it, we've really had success over the last year bringing an ambient tool from Nuance, their DAX Copilot solution, to our physicians and just getting fantastic feedback from our patients, getting incredible quotes and input from our physicians around how really addressing that challenge that they have with completing documentation, getting everything into the electronic medical record that they need to, how challenging that can be and how much of their time it takes. We were really excited that with generative AI and Nuance and Microsoft's partnership, that they truly had an automated solution that could work for our physicians. And so we started with 50 physicians for 4 months using the product. And we also made sure that it was integrated into Epic, that it was embedded in their day-to-day workflows and it wasn't something extra that they had to do or a different login. And the tool simply, via a mobile device, listens to the conversation between a physician and a patient with consent, of course, and then creates the documentation while they're talking. And everybody was we thought it was magic. Folks were a little little hesitant to really understand it. And after those 4 months, the outcomes were just so impressive. We had physicians saying that this would add 10 years to their career because they're not spending as much time late at night documenting. We had a couple of physicians say that they're now getting out of clinic an hour earlier a day to spend time with their families. And where we were really excited too was it wasn't just the physicians who were getting the benefit of this. Our patient satisfaction scores went up by a couple percentage points, which anyone who works in healthcare knows you're always fighting for even 1 percentage point in terms of bringing better experiences to your patients. We have quotes from patients saying they love that their physician was looking them in the eye and wasn't looking at a computer during the visit, trying to get everything into the system so that they could get out and get their medications and get everything they needed to after the fact. So it was just positive across the board. And then we had some kind of surprise value and benefits too. Our physicians were adding each month on average 9 to 11 appointments organically. We never asked them to do that. They were just doing it. And when we asked them, hey, why do you think that is? It was often because, again, they weren't staying late documenting. They weren't concerned about having to get back on their computers late at night to finish documenting if they were going to add on a patient. And so this also addresses kind of our consumer needs, our patient needs. There are wait times in healthcare are a reality. You're often waiting to see your clinicians. And so the more patients those physicians can see, the more we can meet our, community needs of getting in and seeing their clinicians. And so it was really, really an exciting thing and overall has been a big win. We now have 300 physicians using the tool and quite a few on a wait list who are going to get it next. And it's just been a huge win and I think a great show of how AI and focusing where the biggest challenges are in healthcare can really provide benefit to everyone.
This is tying together a lot of, I think, connecting a lot of dots, if you will, in this space. So I love hearing about this. A great example here. I'm curious if there were other, any shout outs that you'd like to give, any team members, if you wanted to recognize anybody by name, any team members or anything like that.
I'd love to recognize the team that we worked with. So we've had a couple of team members here internally at NM have just been instrumental in this. So our program manager, Anu Melville, who led this, really kind of guided the organization through what we needed to do to get the pilot successful. We've since transitioned to Ashley Ellenwood, who's another team member in our innovation team who's now scaling it to the rest of the physicians across the organization. Dr. Gaurav Agarwal is our chief wellness executive, and he was just so instrumental in helping us make sure we were targeting and we were getting this out there to physicians and messaging it as the benefit it could be and not making them feel like this was just another tool and we're going to demand that they add visits or things like that. It's really a tool to improve their experience and to thus, through them, improve our patient and consumer experience as well. And then we have one physician champion, Dr. Cheryl Wilkes, who jumped in from the start, was just so excited about it, and is now sort of independently leading occasional meetings with other physicians, with her peers who are new to the tool. And she's out there explaining how she uses it, how she got it set up and everything. And so our newer physicians to the tool are really getting that direct experience and guidance from a peer, which has been great in terms of adoption.
Amazing. It really does take a village, and I appreciate giving those shout outs there because we all know that that's what it takes to make progress here in healthcare. So thank you for that. One last question for you, Callie. I'm just curious, open-ended, what else excites you about the work that your organization is doing these days?
It's hard not to be excited about the potential for AI. Just in the time since kind of the whole ChatGPT kind of brought generative AI into the spotlight, there have just been so many applications of it. We know healthcare is ripe with opportunity, and so really excited to see what it can do. Specifically at organization, we're looking at additional diagnostic opportunities. How can AI assist in earlier detection of diseases in patients so that we can start addressing them much sooner in the process? How can we continue to use AI to take the administrative burden, not just off of physicians, but off of nurses, off of everyone? There's just so many different ways that automation can help, and the new AI tools are getting more and more sophisticated. And then I would say the other thing we're excited about here at Northwestern Medicine is we are now partnering with Techstars on an accelerator. And so we want to be a destination for startup companies. We want to be a partner for those organizations that are bringing new digital and transformative tools into the industry, who are looking for partners to bring the clinical expertise in an environment that is open to new tech. And so we're excited to continue evolving our efforts to be that destination and to bring the great benefit of technology to both our workforce as well as our communities and our patients.
Fabulous. Thanks for giving us a little inside look into what's going on at Northwestern. And thanks for all the work that you and your team are doing to advance healthcare in all of these ways that make a difference for providers and consumers. It's been a pleasure speaking with you today. Thanks for joining me today.
Thanks so much for having me.
All right, everyone. Very excited. Let's keep rolling here with our next guest. I'm here with Michael Hasselberg again. Michael's back. Hey, welcome back to the Healthcare Wrap.
Jared, thanks for having me. Excited to be here.
Remind our listeners a little bit about yourself and your background.
I am the Chief Digital Health Officer for the University of Rochester Medical Center, a nurse by clinical training. In my Chief Digital Health Officer role, I lead the digital transformation strategy for our health system.
Fantastic. I remember the last time we had you on, and there was a really cool just thought process, I think, behind a lot of the initiatives that you've been working on. And so I want to just say that as a lead up to the fact that we are celebrating today. I'd love to just hear what you'd like to celebrate. This was very open-ended on purpose, but I don't think we get enough opportunities just to recognize the milestones that are happening when it comes to digital health. What would you like to celebrate today?
Jared, I don't know if you heard, but we think the first health system in the country that is now delivering virtual primary care into banks. That was a massive milestone for our health system over the last year. And we have a lot to celebrate around that, because delivering healthcare into non-traditional settings is never easy, let alone a setting like a bank that, as far as we're aware, it's never been done before.
All right, let's dig into it then. I did see the headline and I did see the story, but for those who didn't, tell us what was going on.
University of Rochester, we provide care a very large geographic reach. So essentially the whole western half of the state is our primary market. And so, we have disparities like you would see in any inner city, in Rochester being a mid-sized city, but you go 30 to 60 miles outside of the city boundaries, and it is extremely rural in upstate New York. And in those rural communities, there is a dearth of not only specialists, but primary care providers. Our health system, like every health system in the country, at the beginning of 2020, when COVID hit, had to turn on telehealth overnight to reach patients in their homes. But we had found that in these rural communities that we serve, patients were not engaging in video telehealth sessions. They were engaging in audio only, but not video. And the first thing that you jump to is going, there's probably a broadband issue. There's no infrastructure for folks to get the internet out in these rural communities. And we dug into that theory, and that wasn't the case. There was a significant broadband issue, but it was a poverty issue that patients couldn't afford broadband internet in their homes. So the only internet they had access to was their data plans on their cell phones, and video is a very data-intensive feed, and patients just weren't willing to use their data plans up for video visits. But, we're more than happy to do unlimited talk or texting. And we knew when the public health emergency was going to be lifted, audio-only reimbursement was going to go away. So we really needed to think outside of the box and identify partners to set up convenient locations in these communities where we could do virtual care to, and specifically virtual primary care. So that was really kind of the background leading up to why we did this. We can go into a lot more depth of why banks versus others locations, and we can go into more depth of some of the technology partners that we had to bring in.
Yeah, let's do that. Let's talk about why banks.
One of the things that we have to think about as a health system is scale. And so when people think about telehealth, there's been a lot of research to support doing telehealth into, let's say, libraries or community centers or even barbershops. However, scaling libraries, barbershops, community centers, churches is really, really hard to do for a health system because they're all standalone entities. And so we have to put a lot of resources behind negotiating with every single library across multiple different towns and setting up all of those different lease agreements. And that's a lot of resources on the side of a health system. So we really needed to think about what type of locations in communities are more in a kind of a branch distribution model where, if you negotiate with the parent branch, you could have access to multiple other locations. And good examples of these types of locations could be retail pharmacies. And we know that a lot of retail pharmacies entered into delivering primary care services into their brick and mortar locations. Things could be like retailers. We know of Walmart Health and taking advantage of their brick and mortar reach to deliver healthcare services, although they have since kind of sunsetted that project down. And we initially spoke to a lot of those, what I would call retail disruptors, first to say, hey, would you guys partner with us to deliver telehealth services? And, the retailers essentially told us, we already have our thoughts on what our strategy is. And a lot of them, didn't identify partnering with health systems as being a part of that strategy. So we were kind of back to the drawing board and we had to think about, okay, what else are in these small rural towns? And when you think of a small rural town, you've got a main street, you've got a traffic light, you maybe have a dollar store, and then you have a bank. And so we were like scratching our heads and say, what about a bank? And so you think about the banking industry over the last decade, they've had their own digital transformation, moving from brick and mortar to ATMs to online banking. However, in small rural towns, you still need that brick and mortar bank because those small businesses rely on dropping off their deposits on a daily or weekly basis actually to the brick and mortar bank. And so the banking industry has started to need to think outside the box of how do I keep my small rural banks viable and keeping foot traffic coming into those banks. And at the same time, banks have some beautiful real estates, that oftentimes they're very nice in banks. It's quiet, it's private. And because of their own digital transformation, they have this real estate that they own, but it's being underutilized. The last thing with banks is, banks, a lot of them, especially community-focused banks, have a mission arm to them of wanting to give back to their communities. And so we had a publicly traded community bank that had market share in our market. And we reached out, we explored this concept of doing healthcare into a banking location, and they were like, let's do it. And they were willing and excited partners. And again, given that banks are in this branch distribution model, this ability, if this worked, or if this does work, we could scale it up very, very quickly to other locations across our market.
It's fantastic. Just the strategic thought that went into that about even what the needs are of the bank, of gaining foot traffic and keeping their business going as well, and recognizing the asset that they had with their real estate. I mean, it makes a lot of sense now that, looking back, saying, of course, it makes more sense than maybe you can see the path to why this made sense for everyone. I love that.
To take it a step further, Jarrett, we know that financial health is closely tied to physical health. And we also, again, know our rural communities are some of our most impoverished communities that we serve. My primary care providers, they screen for social determinants of health at essentially every single visit. And so we also had this exciting idea of, well, what if we identify patients in those primary care visits of having financial insecurities? Wouldn't it be great if we could refer them right in the bank to a financial advisor that could speak about the importance of establishing a credit line and, think about different types of mortgage opportunities if they want to, become homeowners. That was this other exciting thing is we might be able to kill two birds with one stone. We might be able to address physical health and financial health at the same time in a single location, which made it even that much more exciting.
I love the thought of this, and the innovation behind it just stands to reason that new things are possible. You mentioned the technologies that took to make this happen. You want to dive into that a little bit?
One of the things that we did need to get out into these communities was, although there was broadband, we needed really strong connectivity to do a seamless video feed back to the university, which in some cases was 90 miles away from some of these communities. So one of the first things we did was, we looked at who were the telecommunication providers that were in our market and who had the largest market share. And, come to find out it was Verizon. And, we quickly reached out to Verizon, saw that they had their own ambitions of moving into healthcare, especially around 5G connectivity and looking for use cases. And they were one of the first partners that we brought into this around, could we bring, 5G connectivity out into these rural communities to help with that connectivity back doing a video visit. So they were one of the partners that we brought in. The second partner was a company that we were already working with at the University of Rochester called DexCare. And DexCare serves as our on-demand video visit platform. And prior to this project, one of our most successful digital transformation service lines is our on-demand primary care service line, which DexCare is the software platform that allows us to do, I need to see a primary care provider now or an urgent care provider now. They go through the DexCare platform to connect with our clinicians. The third tech partner was a company that Verizon actually introduced us to, was called Ihde Health. And so Ihde is a company that, has kiosks. And up to this point, those kiosks did, biometric monitoring and some wellness prevention education. And if you walked into really any retailers or grocery store or pharmacy chains across the country, all likelihood you're going to see a Ihde station in one of those locations. And you can go and sit down and get your weight and get your vital signs taken at them and get some education provided back. We really liked those stations, but we wanted to make those stations telehealth capable, which they weren't up to that point. And so we brought Verizon, DexCare, and Ihde together, and our engineering school at the University of Rochester also helped participate. And we worked on developing a next-gen Ihde station where not only could you get the biometrics done and get the education prevention done at those stations, you could actually do telehealth visits. And so that was a massive lift. I imagine you've got a publicly traded, Fortune 500 company like Verizon. You've got, two startup companies, DexCare and Ihde. You have an academic health system, and you've got a publicly traded community bank, all coming together to develop something totally new and try a new concept that may or may not work. And a lot of this was all in kind. We all believed in the mission, and we all put in resources within our organizations to make this happen.
It's a truly inspiring story, especially the partnerships that it took. And I truly hope this is a model that we continue to see more of. I think we will. I think we'll continue to see partners bringing partners to the table, and that ability for them to come together to deliver care in non-traditional ways, but with the full quality and scope and breadth of services that a traditional health system, that an academic medical center can provide. It doesn't have to be either or. That's one of the exciting things about this, is that it's an and. There's the quality of care and now the access in a place where it hasn't been able to be before. So love everything about it. Wanted to see if there were any other shout outs you wanted to give along the way.
I do want to give shout outs to all of those partners. I truly believe, healthcare is a team sport. It isn't an individual sport. It's not going to be the University of Rochester alone that's going to transform and disrupt healthcare. And I would argue it's not going to be any big tech company or retail disruptor or payer alone that's going to totally transform healthcare. It's going to require these out of the box, large partnerships to come together, and, to have wonderful partners like Ihde, like DexCare, like Verizon, like Five Star Bank, to really think outside the box and to have the right why. We all went into it for the right reasons. We truly believed healthcare could be better out in rural communities, and rural residents deserved better access and higher quality care. And to all of us to come together and to believe in that mission, to launch something like we launched, we're all extremely proud, and we could not have done it without those partners.
Fantastic. What else excites you about the work that your organization is doing, just in general?
When I think about our digital transformation strategy over the last several years, areas that we've had a lot of success has been on the patient-facing side. Essentially increasing access to care within our health system using digital modalities. But when I reflect on the success we've had, in some ways it's been at the detriment of our clinicians on the other end. It has never been easier through some of the cool innovations we've rolled out in our digital front door strategy for patients to directly connect with our clinicians, whether that be through the patient portal messages, emails, video visits, texting, phone calls, you name it. Patients have more seamless access, which is great. But my clinicians are, burning out. And so, where we have really pivoted our digital transformation strategy, and we're bullish and investing a lot of resources, is around how do we remove the burdens, mostly non-clinical administrative stuff that we put on our clinicians' plates. How do we take it off their plates? So A, they can do what they really want to do, which is provide good quality care and spend more time with their patients. But B, allow them to finish their day at a decent hour so they can go home and spend it with their own loved ones. And so I know AI is the hot topic right now, and a lot of hype behind it. But as a health system that has an innovation team that has had early access to a lot of these massive foundation models, and we have been putting our data on top of these foundation models and then fine-tuning them to develop our own tools, I truly believe that AI is going to disrupt healthcare in a good way, and especially for clinicians and making their lives better. And so we've been spending the last, almost 2 years quickly developing tools to make the lives of our clinicians better.
It's so good to have you back, Michael. It's been a pleasure to hear this latest example of the innovation that's going on with your organization and with your partners that lead to this awesome new outcome. Thanks again for being on the program.
Thanks for having me, Jarrett. Anytime.
All right, folks. Next on our list for our celebration series, I'm so excited to be here with Jeremy Harrison. Jeremy, welcome.
Hey, thank you, Jared. Happy to be here.
Want to give us the 2-minute version of who you are and what you do?
My name is Jeremy Harrison, and I work at MultiCare Health System, which is based in Tacoma, Washington, and I'm the AVP for Consumer Engagement and Experience. Our teams manage our external websites, our digital marketing, all of our marketing managers, our customer insights, and customer experience.
It sounds like that's evolved a bit in the last couple of years even, right? Like even the function and the way the team has approached it.
For sure. We've made a conscious effort to really lean into consumerism and start to organize our teams more focused on fulfilling the needs of our various customer groups, including our patients, but also how we support our own team members, our physicians and providers, things like that through our various digital touch points, our website, our digital marketing communications.
All right, well, let's dig into it. Jeremy, what would you and your team like to celebrate?
I think there's 2 things that really come to mind. The first of which, again, thinking about consumerism, we have a visual update to our website, multicare.org. And our web team, our 4-member web team, has been doing incredible work to reorganize the content, be much more focused on guiding patients through their journeys and doing all the basics. As with a lot of healthcare systems, our websites grow by accretion, over time, and we bolt on new things and stuff gets stale. And it's such a heavy lift to kind of go through and straighten everything out and get it kind of back online. And I'm really excited that we have this. By the time this airs, it will have launched in early November, I think. But, point being that we're here to connect patients to healthcare through all of our digital touch points. And that's really exciting that we have such a great team of folks working on our website that are making that happen.
I love that.
I think that, yeah. And the second thing, the other aspect of what we do in terms of demand capture is I'd like to celebrate our digital marketing team and in collaboration with our marketing service line managers around weight loss surgery, bariatric surgery, because they've done some really great work putting together the customer journey from, lead generation to capture and nurture using online health risk assessment, a really robust marketing automation and content to connect those patients to our services. And we've had some great success with that. And I'm really excited that we're getting so much more sophisticated, within the confines of what we can do for digital marketing in healthcare.
I love that. Well, I'll tell you what, it just reinforces the connection that has grown stronger, it seems, by the day between marketing, digital marketing, strategic marketing, and consumer engagement. There's just this line that I know a lot of those responsibilities can be bits and parts, I guess, responsible for with different organizations and different people, different leaders. And yet being able to connect all that and understand why you're doing that, what the business outcomes are, and the day-to-day arbitrage of getting it to work, I don't think it can be overstated. I think just that work, it's worth celebrating for sure, and just acknowledging that it is evolving. And it feels like some of that is because the way that we're understanding what consumers' ultimate health and wellness needs are, that understanding is growing. And so naturally that leads to pivots in strategy, or just kind of a greater understanding among a whole organization. It sounds, that's what I'm hearing here, is that like MultiCare is like that's what's driving a lot of this.
MultiCare Health System has been around for more than 140 years. And, we started out literally in a dance hall, serving the tuberculosis patients in the Pacific Northwest out in the wilds. And what's really exciting to me as our organization grows is that we're so community rooted and focused on consumers, focused on our patients. There's a lot of marketing that happens when people aren't interested at all in healthcare, and feels like you're shouting into the wind. So I'm really excited that our team and our organization are really focusing on the drivers of healthcare and trying to get to the people when they are looking for us. And, it's that right time, right place, right message kind of thing. And, that's a journey, and every single service line is different. Every single region of our statewide system of health, because we are across all of Washington state, it just creates a really complex web. And I'm so proud of our team and the way our organization has organized to meet this challenge.
What are some of the challenges that they feel like have been addressed or overcome leading up to either of those things you mentioned, the visual update to the website or the success with some of the bariatric surgery, digital marketing? What are some of the things that had to be overcome?
Our marketing program, our bariatric surgery, it's really knowing, what the pathway is for people. The sort of journey, the pathway to purchase can be very long in weight loss surgery. It's something that patients will research, and there are lots of options available. It's certainly gotten more complex in the last couple of years with the class of drugs like Ozempic and things like that create different alternatives for people, and sort of working more closely with the service lines themselves, with the operational leaders around what the pathway is and how many folks we need at certain parts of it to then get the result we want. And focusing on the result and then reverse engineering back to what work do we need to do? How many people do we need to reach, and what are the right messages in order to achieve the goal that we want? So, I really like, for me, that aspect of digital marketing and trying to figure out the opposite direction, not how many ads can we put out there and impressions and things like that, but who are the right audiences and how do we connect with them and what makes the most sense? And our team across the board in marketing and our digital teams, the web teams, really get in that sense.
I love that shift, and being able to communicate that shift of where the focus is to actually lead to success here. I appreciate that. I know anyone who's working in the space of consumer engagement, just has those insights and being able to focus on who you're engaging with. I mean, just understanding them and knowing where we capture that, what types of encounters lead to any and any useful information. Yeah, that has never been an easy task, and it's great to be able to see and hear about where that's leading, and not just, hey, it's a thing that's happening in a vacuum. It's not in a lab. It's not an experiment. Like, this is driving the business and connecting people with care. Love hearing that.
And we're not selling something anybody doesn't need. We're not trying to sell pants or appliances or anything. It's really about connecting people to the care they need. And what we're up against is really, sometimes inaction or a lack of knowledge or an abundance of choice. And how do we make that easier, access to care easier when it's already so complex?
What else excites you about the work that you and your organization are doing?
What I really appreciate about what we're doing right now is leaning into, more consumer insight, into measuring how our brand advertising is impacting our recognition in the community. Thinking about the ways that we can break down silos and be more consumer focused, just kind of across the board. There's a big shift into the sort of, if you build it, they will come mentality around healthcare. And I'm really excited that, we're definitely a data-driven organization, like most healthcare organizations are. And we're just doing some neat work in that area that's given us additional insights, which helps inform what we're doing in the marketing space.
I love hearing this wrapped within the brand story of an organization that's been helping people for 140 plus years. Jeremy, thanks for sharing a little bit and letting us share in that celebration.
You bet. Thank you. Appreciate it.
All right, folks, we are here for the final in our celebration series sessions here today, and I'm so thrilled to be speaking with Taylor Hamilton from Ballad Health. Taylor, welcome to the podcast.
Thank you for having me. I'm excited to be here.
I wanted to just pause before we got any further along and just say, I know when I ask here in a moment, what would you like to celebrate? That answer must have changed a little bit from when you and I first engaged on this a few weeks ago, from when we first started talking about, hey, let's book a slot for you. That was pre-Hurricane Helene. And I was not the only one clearly following some of the challenges that Ballad Health specifically had to deal with in the moment. Anything you'd like to share or just recap for our listeners about what it's been like these last few weeks?
Unprecedented is probably the word I would select. I grew up in Southwest Florida, so I grew up with hurricanes and severe weather. It was, mostly like a regular Tuesday. And then moving up to Northeast Tennessee, moving into the mountains, it's something that you would never expect to happen. A lot of the experts in the region and just in general that we've been speaking to are calling it a 1 in 5,000 year event. It was absolutely unbelievable. It was tragic. It changed the topography of Northeast Tennessee and Western North Carolina. It was devastating. It took lives. It took homes. It took a lot, if not everything, away from many, many people. But I will say, out of that, if you have to look for silver lining, which I try to look for silver lining in everything, the support from the community and just from not only the region, but from, the nation, honestly, as a whole, it has been overwhelming. It's been emotional. It has been absolutely incredible to see people uniting and standing up for one another, supporting one another, actually taking shoes off of their feet that they're wearing and giving them to somebody that's walked up to a FEMA or supply tent because they just they just crawled out of mud, out of their homes and walked miles to the nearest town to get help. So growing up and seeing that my whole life is one thing, but then experiencing it here in this part of the country where this isn't a normal occurrence. This isn't anything that anyone expected has been, it's been life-changing. And I'm really proud of the region. I hope nothing like that ever happens again anywhere. I'm sure a lot of your listeners live in areas that have flash flooding and they have hurricanes or tornadoes or you name it. And, Mother Nature is so completely unpredictable, but the power and the resiliency of the community that you live in speaks volumes, and I'm just really proud to live here.
Well, I think I speak for all of our listeners when I say this is a triumph, not just for the industry, but for our communities, our country, our world, truly. And so no one could be happier to hear of the recovery that's been happening since then for nearly all of us who were following it in detail, the devastation happening in real time, to be able to hear of where we are today and be able to point to some of the amazing recovery work that's happened. So we definitely want to celebrate that here on the program. And I will transition a little bit in terms of another piece that we want to celebrate with you today, which is on the digital transformation side of things. You were just mentioning to me some of the tech stack elements that are being put in place now and planned for in the future. There at Ballad Health, I would just love to hear when we're talking about digital transformation, what would you like to celebrate with us today?
As you stated, I work for Ballad Health. We are an integrated healthcare system serving Northeast Tennessee and Southwest Virginia. We were 20 hospitals up until Hurricane Helene, and now we have 19 hospitals because unfortunately one of our hospitals was completely taken underwater by a flood. And we have a wide range of services. My role, which I just absolutely love, I'm the Chief Consumer Officer. And what that really means is that me and my team are charged with working with everyone across the organization to transform the way our patients are experiencing their healthcare. Our goal is to foster a connection between patients and their providers. And ultimately, what we want to do is become the easiest healthcare option to find, access, and use. So that term easy, you're going to hear me say over and over again, because let's be honest, healthcare isn't easy. Healthcare is complicated and it is messy and it's hard. And it is, it's expensive. It's all of these things. So, growing up in healthcare but also growing up in marketing communications and consumerism in general, we are working very, very hard to make it as easy, period. End of the sentence, right? So the tech stack, right? So when we're looking at the consumer, insights is really important. So, Amazon and Target and I could name 50 brands that do consumerism really, really well. The number one thing that they do is they know their consumer probably better than we know ourselves. Some of the predictive analytics of these Amazon warehouses for distribution is absolutely amazing. And I've been reading that based on the data points that they have, they know what you're going to order before you order it, which is why they can get it to you in 2 days or less. Which, if you just think about that for a second, is absolutely mind-blowing, right? We, in healthcare, cannot get that granular because, of course, healthcare is intimate. It is very private. There's a lot of regulations around healthcare with information sharing, with your PHI and HIPAA and everything else. And as a consumer of healthcare myself, I don't want all of my healthcare information out there for the world to see. So what we do is we take any data that is publicly available and accessible. And then we combine that with boots on the ground insights where we're going and we're having one-on-one conversations with our patients and our providers and the community at large to figure out, what do you want? What are you looking for? How can your healthcare provider interact with you in a way that you want to make it easy for you to find access and use? So our tech stack is very important by way of the consumerism division that I'm in. And we have several buckets that we have broken our tech stack down into. The first one is communication. On the patient communication side, we are doing a lot with our chat systems and telephonics for enhanced communications with our patients and our providers and our team members across the system. On the we have information management. So that's more along the lines of content management. So think about forms, right? So if you go onto a website and you are working in a chatbot or you fill out a contact us request, that's a form. Forms need to be digitized. They need to be smart. They need to be intuitive. They need to go into some sort of a data lake where you could be extracting this information to interact for a pleasant interaction. We have patient relationship management. So we receive hundreds of thousands of phone calls every month with anything from I need directions to this specific location to I have a question about my bill, I need to change my appointment, you name it. So we take notes of each one of those interactions so we can get to know each patient really humanize the relationship. Of course, data analytics is huge, right? So we have a lot on our tech stack with data visualization tools. We do a lot of collaboration with Press Ganey, which is one of the industry leaders in patient surveys. That's minimizing what they do. They have a lot more under their hat. But the goal of that is to analyze patient satisfaction because, of course, this is a two-way street. So nobody's perfect. We do a lot of things really well, but we do other things that need some improvement. And we want to hear that. And we do active listening with our patient and our community, and we analyze that. We have one-on-one conversations when things aren't going well to figure out operationally what happened, or was it an engagement, an interaction? Was it a conversation? And we create pathways to help improve that experience. So hopefully it doesn't happen again. We have marketing and outreach is another bucket of our tech stack. So think of things like email, SMS, text messaging, and that really helps with the targeted outreach and programmatic advertising tools. So what's really neat, since I grew up in marketing and communications, you used to have to just throw a cast net, right? It's like a giant cast net. Maybe you caught 2 or 3, maybe you didn't, and then you had to cast it out again. It's really expensive. There wasn't a lot of detail behind it. And now with the different data points that we have, we'll be able to create an email or a text message list that targets specific, and I use target very loosely, but we'll be able to target specific patients or community members that are interested in a specific service because they've told us I want to know more about this, right? So that's really helped us be more advanced on the data side and really help deliver to the community member what they're looking for. We have a lot by way of integration and compliance in our tech stack. So think of things like, again, patient experience, safety, compliance. How do we do as much integration as possible with these to create these seamless operations? And then the final piece in the tech stack is our digital health solutions. Think of that 24/7 virtual urgent care appointment. If you've not done one, hopefully you don't get sick and you have to do an urgent care visit. But if you do, I would highly recommend you look for and seek for a provider that is offering virtual urgent care services, whether it's synchronous or asynchronous in your area. It's absolutely phenomenal. Anytime one of my friends, whether they're local or not, is asking me a question, I'm like, you need to Google synchronous or asynchronous visits near me is the first thing you need to do because it's absolutely incredible how easy it is now to seek care without having to get in your car, wait in the waiting room, then sit in a clinical room, and then finally get home, right? So all of these things, this is the complicated side of what we do in healthcare. All of these things work together. They're interconnected. They're integrated with our EMR. They provide us the data that we need to make really informed decisions on how our patients want us to interact with them, how our providers want us to interact with them to deliver a really great patient experience. On the consumer or patient or provider side, all we want them to know is I have to click a button. And then there's 1,000 things happening behind the scenes that get them to that point where they click a button and get the action that they're looking for. So that's really what we're doing. And all of it is to enhance patient experience.
Are there any team members or vendor partners that you want to give a shout out to?
When I talk to, friends and others in the industry, I think this is such an important part of healthcare delivery is it's making it easy to understand and use those sorts of things. And it's not a one-man job or one-woman job. It's not a department. It's the entire organization working together that has unwavering commitment to putting the patient in the center of every decision that's made. So I would say the shout out needs to go to the 12,000 plus team members that come to work every day, committed to providing the best possible patient care to those that they're serving.
Thank you for that. That's well said. Last question for you, Taylor. Just what else excites you about the work that your organization is doing? Maybe it has to do with this digital transformation, with this experience side of things, or maybe it doesn't. What gets you up out of bed every day?
There's a lot, but I would, what we're doing at Ballad Health that's so special and meaningful is our commitment to reimagining rural healthcare. We live in an area the size of the state of New Hampshire with only 1 million people in it. So if you think about that, we serve 29 counties. So we have to think very differently about how are we going to reach these individuals? How are we going to interact with them? Do they have Wi-Fi? We have Wi-Fi deserts all over the place in our region. So I would say that, what I'm really excited about is Ballad Health's commitment to reimagining rural healthcare to provide access to individuals in these areas of our region that without the dedication of our organization probably wouldn't have access to care. So I would say that is my number one thing. The other that is really exciting is the technology. I mean, technology is changing by the minute, and finding solutions that can ultimately improve patient care, patient delivery, and how patients are interacting with their providers for their healthcare to ultimately improve their healthcare is incredible. I mentioned earlier that I've grown up in healthcare, and just to see how far we've come in the 20-ish years that I've been in the industry is absolutely incredible.
I really appreciate your time here, Taylor. Thanks for shedding a light on some of the incredible work that's happening with the organization. Best wishes with everything you have going on. Thanks for joining us today.
Thanks so much, Jared.